Hello everybody, my name's Lorna Salmon. I'm the Specialist Continence Nurse for Jade Euromed. I'm really sorry I can't join you live today, but I hope you find this helpful and useful. So I cover the area looking after predominantly men who have continence issues that are struggling to get to the toilet on time and have maybe perhaps tried incontinence management tools that haven't been very successful for them. And I offer alternative appliances and devices that will help them either get to the toilet and remain dry or to manage their incontinence. So a lot of what I do is sheath fitting and advice with sheaths that people are struggling with, because normally it's not the sheath, it is a fitting issue. So I can do free training. There's no cost at all for anything that I do along the line. So it's a free service that we offer that goes out to see chaps, and that we will go and see them and get them sorted with some products that will meet their needs. So what I predominantly deal with is sheaths. So I'll go through the different types of sheaths with you and introduce Boris, who's my faithful assistant. He doesn't mind and isn't camera shy. So the first thing when we're going to put a sheath on is preparing the penis. Obviously you always wear gloves for yourself, and if it's a wife supporting a husband, then maybe not so much so, but definitely for any trained professional putting a sheath on, you'd want to wear gloves. Preparing the penis is really good. Make sure he's clean and dry, and thoroughly dry as well. You're going to take the tip of the penis. If it's a standard sheath, you don't need to put any adhesive remover onto the tip of the penis. It's going to be onto the shaft of the penis where the adhesive sticks that you want to protect the skin. So you're going to lift the penis up towards the ceiling and wipe all the way around. You don't need to scrub these on. These will work just as well doing a single swipe around. With the conveen prep wipes that are really good, they add an extra layer of stickiness, but they can make a patient a bit sore and irritated. So I'd never give this to a patient who's got very sensitive skin, and I'd always keep an eye on the patient to make sure. But what you'll find is that they get really sticky and tacky. They start off wet and slimy and then get stickier and stickier and stickier. So you don't want to put the sheath on while he's wet and slimy. You want him to get to that tacky stage. And I don't know if you can see on the video how super sticky that gets, but that's why you'd use the prep wipe. So once you've put the prep wipe on, there's two types of sheaths. There's sheaths that come in a packet. These ones I like to say sit on a little Mexican hat. If you find it's difficult to take them off, by all means, if you squeeze the top of the hat, it will come off really easily. So a little tip of the trade. The other thing is make sure you pull it from where it's clear, not on top of there, because obviously you're pulling that part and it will never come off. So make sure it's pulled from here and comes off nice and easily. So you're going to sit that onto the tip of the penis, making sure that the end of the sheath is lined up with the urethra. And then almost using a flicky motion, you're going to start to unroll it back towards the body. So it's unrolling evenly. Once you've got it going, by all means, it's really easy to use it like a joystick and to point the penis up towards the ceiling, which will give you more room between the scrotum and the penis, which will make it so much easier and you're not going to get things stuck on the inside. As they continue to roll it back towards the body, all the way down the shaft. Once that's unrolled as far as it will, hold it for a few seconds. You're not squeezing. Don't squeeze the penis. Hold it. If he can do it, get him to do it. Obviously, the least things that you have to do, the better. And then that won't fall off. Do not do this on your patients, but it won't fall off. It'll be super stuck. If you need to, if there's a bit that hasn't unrolled fully at the end, or if it's somebody who's maybe going to be a bit forgetful and a bit fidgety, there are extra things that we can get. This is called an M450 foam strip. And this can go around half on the skin, half on the sheath, and it will give it a bit of extra staying power, and it will enable the sheath to stay on if it backflows slightly. But what it will also do is it will give it a bit more stick if it's likely to be fiddled with or interfered with. So it's just a bit more of a barrier to prevent it from being pulled off. Yeah, so they can be really useful, and they can also, if you've got a rim that hasn't unrolled, it will stop the sticky bit from sticking to the abdomen or underneath and getting sore. So again, a good reason as to why you'd want to use those. Taking them off, you'd obviously unroll the sheath from there, and then at the end of every sheath is a lip that has got no adhesive in. That is where you'd want to spray the adhesive remover spray to take it off, and that is really good to make it so it's not going to cause any trauma to the skin. And with using the adhesive remover spray, it will just fall off. You can also use warm soapy water. It doesn't, if they do run out, it's not the end of the world. Okay, so that's a sheath that is not a conveen. This is a conveen. Now, the difference between a sheath and a conveen is the difference between a Hoover and a vacuum cleaner. It's a brand name. A conveen, which is only these ones in the green hard cases, a conveen is the only one that's got the tag on it. So the tag is an aid for carers or for the person putting it on to put the sheath on and help it to unroll. These tags can be really good if you've got somebody who's got poor manual dexterity, or so I do tend to use them for carers if they're want minimal contact with the actual penis itself. So these ones, you'd still prepare the penis shaft in the same way, and you'd still sit the sheath onto the tip of the penis. And then with these, all you do is you pull the tag back towards the body, and you pull until the tag comes off in your hand. Don't try and unroll these sheaths, because you'll just get the tag in a tangle. Unroll it, make sure it's fully unrolled. Again, hold it for a few seconds. It does two things when you hold it. It gets the adhesive into every little nook and cranny, but it also warms the adhesive up, making it stickier and tackier. Now, every sheath you put on should have a bit at the end that's empty. It's a buffer zone. This buffer zone is really good, so when the chap's having a wee, for it to give it time to go round and down into the tube. If there's no space there at all, then it won't have enough time to get into the tube. So having this buffer zone is quite important. Okay, and again, you'd remove this in exactly the same way with the adhesive remover spray in the inside, and it will just fall off, again, not causing any trauma. So they're the two main styles of sheath. Within that, there's different types of adhesive, there's different lengths, there's different widths, there's different sizes, and so it's really important that they're measured properly and that they're taught how to fit them properly. Most sheaths fail because the pipe doesn't flow downhill quick enough. Every system for the urine is a gravity-fed system. It has to flow downhill. And if you've got somebody who's got the pipe going up and over their leg, the urine will always go the easiest way. It will always go backwards. And if the urine's hitting the adhesive on the inside, it will loosen it, it will balloon out, and it will explode off. And obviously that's not what we want, and it defeats the object of the point. So we would always ensure that the tube is going down the hill, and that means even at night time, so the tube's going down the hill, under the leg and out of the bed. So keep an eye on the skin, make sure that if they've got somebody who's really emaciated, quite thin, that you've maybe got a pillowcase or something to protect the leg, but you need it going downhill, else it will not work. So if somebody's got a good penis length, a sheath is a really good option. If their penis is quite small or prone to retract or has got a sore on it, there are other options available. So one thing we could try is something called a Bioderm sheath. A Bioderm sheath is a different type of sheath that doesn't adhere to the head of the penis. It adheres to the, it doesn't adhere to the shaft of the penis, it adheres to the head of the penis. So with this one, excuse Boris poking his little head in. So with this one, it comes with its own little barrier wipe. And we're going to pop this onto just the head of the penis. And you'd wipe it round. Again, you do not need to scrub it on. Just a single coating is absolutely fine. And these sheaths look very different to the other sheaths. So these sheaths look like little flower petals. And they're really good, say, for somebody who does retract in. There is an up and a down, and you want to make sure you got it facing the right way. It says up on the top of it, and on the stickers it says up also. but you can see there is a bit of an angle on it, so you want to make sure that you have got it the right way round. And you're lining up the hole on the back of the sheath with the urethral exit. So you'd line up the two together, and then you would push the petals back, up, down, left, right, all the way around until they're secured and you've got a good adhesion. Then at that point, if he can do it, brilliant. If you have to do it, that's okay too. Hold your fingers around it, again, just to get that warmth in and make sure you've got a good stick. And then there's a flange included as well. Take the backing off of that. And then starting at the bottom, you're going to go up and around on the left, up and around on the right, and then hold it for a few seconds there. And the warmth of your hands will get that stuck really securely. Again, you can see there's a buffer zone there. That buffer zone is going to give it the time to go round down and into the tube and connect to the bag. Any external system, so any sheath or pouch, which I'm about to show you, isn't going to cause any extra risk of infection. So unlike a catheter, you can then use a reusable leg bag and night bag. So both of them are going to be drainable and both can last up to a week. They don't need to be changed every night like the same with a catheter, because there is no increased risk of infection because of it being an external device. You haven't got anything going up and inside the urethra. You'd still remove this with an adhesive remover spray, but as you can see, it sticks really well. And these are the ones that the astronauts used to wear, apparently. So take that off with the adhesive remover spray, and every sheath is licensed for 24 hours. So another good option that is used a lot for somebody whose penis retracts is something called a pouch. Now these are universal because it can be cut to size, but the great thing about a pouch is it will stick over the top of the penis. So even if the penis retracts incompletely, and these are really good for somebody who's got an altered anatomy, so somebody who might have a hernia down there, or somebody who's morbidly obese, a bariatric patient, they're really good for sticking in unusual places, as well as, say, for over the top of penises that retract. You can cut them to size, so if you have got a penis who, when you push into the pubic area, the penis will kind of come forwards. And so you can see how big the penis hole there needs to be. The knobble wants to point towards 11 o'clock when you stick it on, because the bag, again, is angled. So you don't want to stick it on the wrong way, else it won't flow through. These are a really good product. These are not so good. So these are designed if somebody's got a bit of functional or overflow incontinence, that they could perhaps put that cap on. But it's super fiddly to put it on, really difficult, even if you've got full manual dexterity to get the cap on. And I mean, you can, but as you can see, it doesn't go on very easily. The other thing is it makes the capacity of the bag very, very small. And generally, if I'm prescribing this, it's for somebody who needs it to go into a night bag. I use these a lot at night time for people. But you'll often find that these aren't big enough by themselves. The sticking area, especially where it comes down and over the scrotum, isn't big enough and can sometimes leak. So what I often prescribe them with, and in conjunction with, is a flange, which you can increase the sticking area. You can either put one just at the bottom or at the bottom and the top. And I'd still prepare the skin underneath with a prep wipe, because you're still sticking an adhesive onto a sensitive area. So I would always protect the skin underneath. And so if you need to make it a bigger sticking area, then you can do with the flanges. And obviously you'd need to shave underneath. So if somebody's not prepared to shave, which isn't very often because most people would rather be bald than incontinent. So yeah, so that's that. And so everything I've shown you so far will all fit onto a standard bag because they're all universal, and that can mean that you can use the same port for daytime bags and nighttime bags. What I really want you to take from today's session is that there is always an alternative. So if somebody's tried pads and it's not for them, or they're leaking, then there's another option. And some of those options are prettier than other options. One that's not so pretty is this one. It is called a figure 101, or is commonly known as a wombble. And these are really good for somebody whose penis can retract, because it works with pubic pressure. So like I said, when you push into that area, the penis can come forwards. That is really good for that. It's made to the right size for the patient, so they'd be assessed, and that would be a snug fit over the penis. And then that goes down into a bag, and that works really well for people who've got an overflow incontinence. They need to recognise that they need to go to the toilet with this, is the idea of this one. And then it can give them extra time to get to the toilet. It catches all the leaks and dribbles. Somebody who's got to the toilet but can't pull their things down quickly enough, so like a functional incontinence, it's really good for that, because the valve's really easy to operate once you've got it up and over the place, over the toilet, to empty it out or into the bottle. The other thing this is really good for is somebody who's got to the toilet but their flow rate isn't strong enough to get them over the lip of the toilet, and it goes down the front of the bowl. And that's really frustrating for a lot of people, because they're not being truly incontinent. They've got to the toilet, it's just the wee's not going into the right place. It's like an extension tube. It just gets the wee where it needs to be. And if that saves them getting wet trousers or wet floor, that's so much better for them. And although not the prettiest of products, it works really well for those sorts of people. A prettier option are the Acti-Brief pants. I don't expect you to remember all the names of everything I'm showing you. I expect you to remember there's a difference and a choice that people have. Okay, so again, these holes come in different sizes. The pants come in different sizes. Super comfy, super stretchy. And these are machine washable, so the patient will pull these on, pull them up like normal pants, pull their penis right through the hole, and then clip the bag onto the front. Again, really good for the same sort of chap I was just telling you about. Not so good if he's completely retracting though, because there isn't any pubic pressure with this. It's a nice comfy flat backing, but so that will hold him nice and snugly, so hopefully you won't retract out. But ideally you do need a good inch for these to work well. The biggest problem with these, which is unfortunate, is where you clip the bag on, it's quite a narrow rim. And so if somebody's looking over a bit of a big tummy to try and push it in, it can be a bit fiddly. And if you haven't clipped the bag in properly all the way around, it comes off quite easily. But once it is clipped on properly, it's more difficult to dislodge. So or the other thing with this is the valve can be a bit more difficult for somebody who's got poor dexterity. But again, it's a nice discreet product and works really well. Some of you might have heard of the Afex system. Afex, these are the briefs. There's like pants available as well. So there's different options. So the pants I've just shown you, Afex do some pants as well. This is similar but different. It's got a plastic container there which has got some holes to make it more comfortable on the inside. There we go. And so you'd put a cuff around the penis into the hole at the back, and that would then go down into the bag, which you'd use as an extension tube or as an overflow container. And then fresh out on the market are these are like really comfortable boxer shorts that can connect to a bag. Again, really good for overflow incontinence. These ones aren't so good for a patient who has got a retracting penis, because there's no pubic pressure, but it will hold him nice and snugly, and this part comes in different sizes, so you can get it so it's a nice snug fit on the penis, so he isn't retracting out of it. But again, he would need the right size penis to make these work, which he would be assessed for. Absolutely everything I've shown you is available on script, so won't cost the patient a penny. The other thing that can be beneficial is something like this, and I can do bottles and appliances and devices, but this is a really helpful little device. It's called a Uri bag, and it is basically a portable bottle. If you can imagine how big the bottles are, that they're big and cumbersome and you don't want to take them out, but if you're getting caught short when you're out and about, this holds 1.2 litres, which is quite a lot, so that's more than 2 big wees. So it's really good. You can empty your bag out into it, or you could wee directly into it. There's a female version of this available as well. And then once it's sealed up, it's completely watertight, so it can get you home where you'd rinse it out, dry it, and then reuse it. They last, well, they can last up forever, but say you're entitled to a new one every 6 months. So what I really want you to know is there's always a choice. If you need to get hold of me, my telephone number is 07766 667 330. That's 07766 667 330. And my mobile, my email address is lorna.salmon@nhs.net. So it's lorna.salmon@nhs.net. So if you need me to come and see a patient, you can do a joint visit with me if you want, and I can go through what I'm doing and why I'm doing it. Absolutely fine. If you just want me to go and see a patient that you've been struggling with, or that's been getting wet, or has got moisture lesions, then let me know and I can go out and help and support him. Okay, I'm so sorry again I couldn't be with you, but you can phone me and I'm here for you moving forwards. Thank you.